Hi, Dr. Brian Kaufman, a family doctor, a CLL patient myself, and the Chief Medical Officer, Executive Vice President of the nonprofit CLL Society. And I'm here with a good friend, another family doctor.
Hi, I'm Larry Saltzman. Yes, a family physician and the Executive Research Director of the Leukemia and Lymphoma Society. Thank you.
And Dr. Saltzman, you did some, and with your colleagues at LLS have done some really important research on how CLL and all blood cancer patients have responded to the vaccine, which has not always been a robust response. And you presented some of the latest data just last month at the American Society of Hematology meeting. I understand you have some slides and stuff that you could walk through with us and make it kind of patient friendly in terms of what patients should take away from this. Thanks.
Yes, I will do that, Brian. We did present, and yes, things on the ground keep changing every day, every hour. And these are good. We can see the slides. Yes.
Perfect. Yeah.
Okay. So how about now? Good.
Even better. Yeah.
Okay, so let me run through some slides. These are 2,200 people that we have analyzed with regard to COVID shots, vaccines, and their response with antibodies. You can see we have about 2,200 people. The big majority of people are CLL patients, thanks to you and your society. And we are median age of 64. For better or worse, we're very much skewed to white Caucasians, and that's just what we have. And then you can see under types of vaccines, we have almost 50-50 split between the two mRNA vaccines, little skewed towards the BNT vaccine, but this is what we have. And let's see if I can make this work. Okay. And this is a big pie chart, a lot of Pac-Men, and I'll zero in with you, but this is what it looks like if we break down the patients to the responses. And you can see of the pie charts in the upper left-hand corner are the CLL patients. And after 2 vaccinations, 68% of CLL patients did respond to the vaccine. So that left 32% of patients who did not. And it's not it's not the best, of course, it's not the worst. You can see we did separate out SLL patients, a very small number, 41. They were about the same, although had a little less response. And so these are the pie charts. And if you had Hodgkin's, almost 99% of people responded. You can see MDS and MPN on the bottom row towards the left. 100% of the 45 patients responded. So we're in the group of B cell problems. So CLL, Waldenstrom's, follicular lymphoma, those kinds of things. And just to put a box around it, these are the box of the B cell types of leukemias and lymphomas and how they responded. Not as good as the others. Okay, and then we've done a research analysis just so we can see where we all stand as CLL patients. And if you look at the black boxes, CLL, NHL, MM for multiple myeloma, and the top one for leukemias, you can see that our big dots are towards the left side of the screen, and we are about as unresponsive as any of the other blood cancers, unfortunately, if you were to build a trend line of this. Now, as we looked at the treatments after 2 vaccines and who converted and who didn't, it's pretty clear that the disease itself has some problems. So if you were not on any treatment, 17% of CLL patients did not respond to the vaccine. And then it gets worse. If you look at anti-CD20 antibodies, rituximab or obinutuzumab, you can see that it's as high as 90% of patients didn't respond. This data has been presented. It's not new. It's not earth-shaking. This was based on the first two vaccines. And so let's get into some newer things. We wanted to study whether a third vaccination will provide protection for patients with B-cell derived malignancies. And by CDC and FDA guidelines, those of us who have these kind of malignancies are eligible for a third vaccine as part of their primary series. So just to be clear, when they talk about boosters, for those with immunocompromised conditions, the primary series should be 3. And when they talk about boosters, they're now talking about vaccine number 4 for us. But here we're looking at 3 vaccines, and you can see on the timeline, we looked at vaccine 1 and 2, waited some months, looked at vaccine number 3, waited some more months, and then we're looking for the data. Now, the good news is that 43% of patients actually seroconverted after the third vaccine. So that shows us that it did work. And I'll split that out a little for everyone in the audience. First, let's just look at this. This is 700 people that we looked at. And if you look at the left-hand side, you can see that there were 139 people of the 700 who just did not seroconvert. If you look at the other scatter charts, the one in the middle and the one on the right, you can see that for people who started with something, there's a clear trend line that they did have an even better response with the third vaccine. And this is why we are promoting this. And we do believe that with a 4th vaccine, this trend will continue, although that's what we're studying actually right now. This is the pie charts of a response to the third vaccine by disease type. Again, CLL is in the upper row towards the left. And if you look at the color coding, you can see that what you have left in the blue are the seronegative patients. And the other 2 colors, the gray and the orange, are people who have responded. And so really when you
So I'm
get
going to
down
stop you there for 1 second, Larry.
Yeah.
Seronegative means that they did not form antibodies.
Correct, to any of the vaccines. And again, that is correct. And if you look at the CLL pie chart, you can see that now the blue part of the pie chart is probably about 20%, which means after 3 vaccines, 80% of CLL patients have responded to the vaccine. That's a much better number than we might, kind of banter about. And so that's good. And as we look deeper into this, we can now look at response to the third vaccine in CLL patients by treatment. And what we're looking at on the left column is the treatment type. Then it goes column by column, number of patients, how many were seronegative before the third vaccination, how many seroconverted, and the percent of seroconverted after the third vaccination. And again, the number that is most at risk here are patients who are on anti-CD20 treatment. So again, the rituximab and obinutuzumab are the treatments most at risk. And we really don't have a timeline onto how long after one has been treated with these that they will respond. But we know it actually plays out probably to at least 6 months and maybe even a year or more after those treatments. Otherwise, if you're on no treatment, 65% of everyone will seroconvert who didn't convert before. So it's not, it's not a terrible thing, and we shouldn't just be very sad. I mean, it does seem to work. And our conclusions are that about, in total, 23% of blood cancer patients are failing to respond after 2 doses. 43% of patients actually seroconverted after the third vaccine, which means half the people who had a third vaccine who didn't have any response in the beginning did convert. So now we're probably down to 12% of blood cancer patients who haven't had a response to the vaccine. The third dose response is reduced by anti-B cell therapies, including primarily anti-CD20, monoclonal antibodies, and somewhat BTK, and CD19 CAR T treatments does definitely affect this. Now, IVIG infusions, as it's turning out, are likely to contain increasing amounts of anti-SARS-CoV-2 antibodies. So if one is getting IVIG on a regular basis, we know from the pharmaceutical companies and from the serology and surveys they've done, antibodies are now in this product. Now, having said that, the plasma takes a while to catch up to what's going around. So the antibodies in the product are primarily from the alpha, beta, delta wave of the COVID virus, and not from the Omicron as it is now. So that has to catch up. And breakthrough infections and poor outcomes are still a concern in B-cell derived and immunocompromised patients. We're seeing data that says, I don't know, 10 to 12% of immune compromised people still have a severe illness. And so that's our, that's our current rundown for today. Difficult, but maybe not as bad. And Brian, I'll just state with you that, let me stop my screen, that LLS is about to launch the study of fourth dose patients. In our study, we have about 1,000 people now that we've followed through the very beginning, from 0 vaccination through 3 vaccinations. And actually, we will be sending out notices to those 1,000 people that we think they're now due for their 4th vaccine. Again, the CDC and FDA just created a new timeline. So 5 months after a 3rd dose for, again, immune compromised people, you can get your 4th dose. And that 3rd dose was approved August 15th of 2021. So we're coming right upon the time when many people would become eligible for that. So LLS will be sending out emails and invitations to hopefully go to the lab before this 4th shot, so we can see if there are lessening antibody levels, if they've gone down, and then again after. And that'll probably be the final part of the study that we're going to be doing now.
Well, I'm really glad to hear that, because it certainly gives encouragement that if they, and other people have presented data, and I think you had some preliminary data, where after the first shot, the responses were pretty dismal, but they got better with the second, and with the third, we see that they continue to improve. So while we don't have any proof, there's reason to believe that a 4th shot will help, but we don't have any data. So I'm so glad LLS is making this part of their research. Yeah,
Yes.
The other thing I would add is that a lot of people have looked at this in different countries, and the data is all quite harmonious. I mean, there's differences in numbers, but what we're finding is generally the B-cell lymphomas, with CLL being one of the poster children for that, don't tend to do very well. And that people on the anti-CD20s, which kill off B cells, which make antibodies, tend to do the worst, and that seems to linger for 6 months, a year afterwards. So the data is pretty consistent. I know that you're researching T cells and you haven't published anything yet. Can you give us any hints on when that will be coming? And because people are very interested in that. There was one paper that suggested that T cell function was not robust in blood cancer patients, but about 25% of people who had no antibodies did have some T cell response. So I took that as a little encouraging.
Right. So we have 500 and some people now that we've analyzed T cell results for. And where we're at right now is we know, in a general sense, there are about 25% of these patients who did not produce any antibodies after 2 vaccinations. This is still early, and did not produce any T cells. And what we're doing right now, before we publish that data, is, as part of our registry, we've asked people to share their medical records with us. And we have now analyzed half of those negative patients, if you will think about that. We're waiting to get the other sets of the records before we come to any conclusions. We hope to have this published or out, in the public in the next 30 to 60 days. We don't want to wait much longer than that because it's really important. And so we want to thank everybody for not only going to the lab to have their blood testing, but sharing their medical records with us, because we're very interested, in CLL patients, as an example, by flow studies, which markers did they have or didn't they have? And, by treatment types, are their total white blood cell counts affected? And is that a reason for this or not? And frankly, we don't have the answers yet, but we do know that we have segmented these 500 people into 4 buckets, if you will. The negative bucket are about a quarter of them. The positive bucket are about a quarter of them. And then the other 50% are in the middle. They've each made some of T cells and B cells or the like. So, we will have to see. But again, this was done before Omicron. And honestly, we started this project last June, so it was done before the 3rd vaccine. And we'll see how the final results come out before we decide if we're going to do any more testing of this.
If people have already given blood for this, they should expect a letter.
Yes. If people are in the study, they will personally get notice of the results of the study. But the T cell study that we have undertaken is not a clinically approved FDA test. So we are not able to give back an individual's results. And that's why before we publish this, we're trying to see if we can really nail down some coordinating ideas of who's in what bucket, and then that would be better if we can do that.
And if someone hasn't given their blood yet for this or been involved, is this study still open, or is it only open for the people who jumped in earlier at this point?
Yeah, the T cell blood drawing is closed at this time.
And what about the antibody study? Is that closed too? Or?
The antibody study is open for these last, like I said, about 1,000 people who are going to get invited, who really we have been following intimately from the very beginning. And when I say intimately, is that we know their antibody levels pre and post every vaccination that they've had so far. There's no holes in the data. And that's very important. And so we're sorry that if somebody now getting a 4th vaccine and they said, well, I just would like my blood tested, it's really outside of the bounds of our study. And these tests are now commercially available. So anybody can go to their doctor, and although not FDA recommended as a way to decide if one is immune or not, the tests are available commercially.
And I would add that at LabCorp, you can order the test yourself. And it's, I think, $20 if your insurance doesn't cover it. You don't even need a doctor's order. But it's something to discuss with your clinician about how appropriate it is, and it needs to be interpreted in a full context. Any final thoughts on this important research and where you see it going, its impact for patients?
We think that, we've kind of learned the trends. We don't see the trends changing much. We'll see what happens with the 4th vaccine. We are still very much in the mindset of please get vaccinated, and please, especially at the moment, act unvaccinated. The wildfire is, essentially out of control. And we can't tell each other which one of us, yes, I'm a CLL patient as well. We can't tell each other which one of us is more or less susceptible to this. And, if somebody's had COVID, in the past, they could still get another variant of COVID. I mean, we just have to be just awfully careful.
I agree. At least for now, get vaccinated, and vaccination probably consists of a primary series of 3 and a booster 5 to 6 months after. And we may end up getting boosted every 6 months down the line. We don't know yet. But, and then still all the hand washing, face masks, and with Omicron, KN95s or N95 masks, not a cloth mask, not touching your face, staying out of crowded indoor spaces. All of these things are still very important while we work this out. So it's a transition time, and hopefully this will pass quickly. Dr.
Yes.
Saltzman, on behalf of the CLL Society and the CLL community, I'm so grateful for what you and your colleagues at LLS are doing. This is such an important piece of data for us to understand. Thank you so much.
Thank you. Thank you, Brian. It's my pleasure. Really, take care. Stay safe. Thank you.
Thank you.